Good afternoon, everyone. For those of us joining us by live webcast, I am Lee Clausen, the Executive Director of ICA, and I would like to take this opportunity to thank Desert Harvest for their generous support of this session, Integral Approaches to Treating Interstitial Cystitis. And I also have the privilege to reintroduce our next speaker, Dr. Anna Kelly. Dr. Kelly is Medical Director of Metro Pain Center in Atlanta, Georgia, where she actively practices integral medicine utilizing acupuncture and related treatments such as cupping and Chinese herbology. Dr. Kelly is an anesthesiologist board certified by the American Board of Medical Acupuncture, as well as the National Certification Commission for Acupuncture and Oriental Medicine. She also holds a Master of Arts degree in Applied Healing Arts from Thai Sophia. Please join me in welcoming Dr. Kelly back to our stage.
Thank you. Good afternoon. I would like to thank the Interstitial Cystitis Association and all the wonderful people who helped organize this event. I love it when things start and end on time. And so I am honored to be here today with so many wonderful speakers. Almost every time a speaker has made a point, I've thought to myself, yes, I want to make that point too. But I promise not to copy all 5 or 6 speakers that have been here already and bring you something new today. I'm a bit of a defector. I was trained in Western medicine and employed by various anesthesia groups delivering anesthesia to surgical patients. I also worked in the chronic pain patient population in the hospital clinic and then later in private clinics doing blocks. And I no longer do that. I became very dissatisfied with being merely a technician. So I defected from Western medicine and now practice something called integral medicine. I've had a little bit more difficulty than usual in preparing for this talk, not because of the slides, those were done weeks ago, but because I'm going to be talking about something that's more nebulous, if you will, than scientific materialism. I'm going to be talking about something that's less well studied and documented, something that's less well measured, and something that's less material than surgical or other interventions like medications. This is integral medicine, where aspects of health that go beyond the numbers, beyond the microscopic findings, are just as important. So health is seen as an integration of all aspects of what it means to be human. So this makes me ask the question, well, what does it mean to be human? So we simply can't leave one aspect of our lives out. The truth is, I don't know what it's like to suffer from chronic daily pain. I don't know what it's like to have frequent or urgent urination. But I do, as I suspect most humans do, suffer from other things. And I work with chronic pain patients on a daily basis in my practice. So it's with a spirit of great humility that I stand before you today and talk about my passion, acupuncture, in the integral medicine setting, and what I've learned from working with chronic pain patients over the years. Many of these patients have found the Western medical system to be inadequate in the treatment of the complex disease of chronic pain, pelvic pain, interstitial cystitis. Many patients have found Western medicine to be inadequate in treating the complex, the beautiful, and the ever mysterious thing called a human. So I want to talk with you a little bit about why I'm a defector. Descartes was a Western mathematician and philosopher in the 17th century who described the body as a machine composed of parts, much like your automobile. So you can see on this model that the lungs are bellows, the kidneys are a filter. The bladder is a little holding tank there. And the joints are cogs and wheels. Eastern medicine views the body as a garden, a theater almost. As Barry Jernigan talked about the pelvic theater, I'm here to talk with you about the human theater. And it says, how are these parts related one to the other? So you can see if there's excess cloud cover outside, that's going to mean perhaps that there's more dampness in the basement. If the weather's rainy, you're going to have dampness in the basement. I'd also like to make a very important distinction between integrative and integral medicine. Integrative medicine is becoming an increasingly popular term, and we've talked so much this morning about the multidisciplinary approach. But let's bear in mind what we mean when we say integral. It doesn't just mean choosing 2 from column A and 3 from column B and 2 different therapies from column C and finding out what works for you. That's integrative medicine. Integral medicine expects that all lines of development will come along, so that there's not only a wholeness of the body, but there's a wholeness in relationships, of practitioner to patient, of husband to wife, of mother to child, brother to sister, employer to employee. So one of the overarching themes in my practice is, what's your relationship to all of these things like? And so acupuncture is a very useful tool for practicing integral medicine because it is a science of relationships. Acupuncture is also a science of integrity. If we look at Western medicine and we say, what's the integrity of the structural system? What's going on in the bladder wall, for example? Eastern medicine says, what's the integrity of the functional and energetic systems of the body? And so integral medicine gives me a chance to peer into and to discuss things that we don't often talk about in a traditional medical clinic. Integral medicine considers, of course, the patient's health history, their current symptoms, their medications, what their work is like, what are their activities of daily living. One of my favorite questions is, what do you enjoy about your work? And what's the most challenging thing about your work? I had one patient, I said, what do you like most about your work? And she said, the people. And we talked a bit about that. And then I said, what do you find most challenging at your work? And she said, the people. Integral medicine also looks at constitutional type. Acupuncture is a beautiful way to consider the different constitutional types that we are. It makes a distinction between the fiery, talkative woman who moves about a lot, crosses her legs and uncrosses her legs a lot, and the quiet, contemplative comrade that she has. It also looks at our cultural conditioning. In the South, there's a construct that whenever you ask a woman how she's doing, she almost always says, fine. And this can create a division within. When we look good and we're coordinated and we've matched our shoes to our purse and we've put on a good face and we're out in the world, how many of you have experienced a disconnect when your bladder is calling attention to itself? You've had to stop 20 times on your trip, on your 2 or 3 hour trip to the mountains, and you get there and someone says, how are you doing? You look great, you know, and you feel terrible. This can create a disconnect and a discord, and a lot of the chronic pain patients that I've worked with over the years have seen the fallacy in thinking, well, I'll just compartmentalize the painful part of my body off. If they have a painful limb, I just won't think about my leg, for example. Or if it's the bladder, I just won't think about my bladder. And this, as you know, doesn't work. So one of the things integral medicine does is it helps us reintegrate all body parts and all aspects of what it means to be human together. It also looks at the cultivation of virtue. It asks a lot from the patient. It asks that you actually develop and change over time, so that if you know you have a trigger food that will consistently make your bladder pain worse, that you would properly exert your will and not use that food if you've decided that you're not going to do that. So I have a lot of patients that say, I'm going to do a gluten-free diet. They meet with a nutritionist, they commit to it, And then usually sometime later, there's a relapse. And so we talk about that in Chinese medicine, and there's a lot of points that we use in acupuncture that help patients properly exert their will in a world of endless choice. So integral medicine is beyond any technique or style. I'm actually going to be talking about acupuncture, but I understand the physicians and speakers that are going to be talking after me are going to speak about other complementary and alternative medicine techniques. Integral medicine considers something called AQAL, and I'd like to talk with you about that. Not that any particular practitioner you might see knows about the AQAL theory, but I think it will help you understand which practitioners are developmentally inclined and are going to be looking at all aspects of what it means to be humans, and which are mere technicians of body parts. By the way, I'm a big fan of Western medicine. I use it regularly, as do my family members. And the good thing that came out of this Cartesian model of man is we have these wonderful medicines, for example, that we talked about earlier today. We have the ability to transplant an organ should you need an organ transplant. So it's not that one model is wrong and the other right. Of course not. That's overly simplistic. It's just that one without the other I consider incomplete. And so I operate and interface a lot with practitioners of both styles of medicine, Eastern medicine and Western medicine. Integral medicine has development as its goal. So over time, there's more wholeness, less division. I think another reason I found it a bit challenging is, number one, I'm talking with patients. Now, I talk with patients every day in the clinic. Why would this be challenging? Well, I'm talking to an audience. I'm presenting my life work and telling you what I do, and I'm going to be making generalities, and that does not apply in every case. So we're going to be talking about, for example, a specific herb in just a moment, and it may or may not apply to an individual. So that's the whole point of seeing a practitioner who can individualize her treatments. She can appreciate that each and every one of us bring something different into the treatment room. Now let's look at AQAL, all quadrants, all levels. Please don't worry if you can't read what's in each of these quadrants, but you can see there's 4 quadrants on the slide. There's a right upper quadrant, and this is where Western medicine lives, so to speak. It's about it's about objectively measuring what's out there. So it says, let's look at 1,000 patients that have interstitial cystitis, and let's measure certain proteins in their urine. It's an objective measurement of the physical world. The left upper quadrant is something that I think gets lost often in Western medicine. It says, what is your subjective experience? How many of you have felt dismissed when you've been to the doctor? He's back. Only 2 people, 3 people raised their hand, but I have a feeling it's more than that. I had an experience recently where the doctor was backing out of the room as he was talking with me, writing prescriptions on a pad. It was very unsatisfying. And so there's a healing that occurs when, for example, we care for a fellow human being. I love that Dr. Carr's favorite opioid is a mother's touch and a mother's love. And the truth is, probably endorphins are released. These natural painkillers that our body produces are released when someone hugs us, loves us, cares for us. But there's something that's beyond that endorphin that's present. And I, for one, can feel it. The left lower quadrant is our intersubjective experience. So we come together this weekend to discuss chronic pain, chronic pelvic pain, bladder pain, nutrition, the multidisciplinary approach to the patient, physical therapy, sexual therapy and healing. And what's that like when we all come together? There's a consciousness that exists between us. And one of my favorite scientists is a man named Rupert Sheldrake, and we're beginning to see that consciousness of each of us as individuals seems to extend beyond the physical body. And so what is this intersubjective relationship between us when there's a collective and mutual striving towards that which is higher, that which is more whole? And in the face of more diversity, can there be more integration and more wholeness and more unity? And this spans not just the medical considerations that we're here to discuss this weekend, but we're living in a more global community than ever. And so integral medicine considers what it means to be a human from a very, very large, even cosmologic perspective. We are sitting here, the end product, and hopefully there'll be more coming after us, but the end product of 14 billion years of cosmic unfolding. And that puts me in a position of great humility. I think my life's but a blink in relationship to that 14 billion year unfolding. So I do often ask myself, why are we here as humans? You know, this is an important existential question that matters. The left lower quadrant is very important as we consider the Affordable Care Act and Obamacare. How do we take care of ourselves as a society? So what are the rules and laws and reimbursement issues that come up around health care? I broke free not only from Western medicine, but also from the very increasingly broken and perhaps corrupt third-party payer system. And yet I'm struck that I use that third-party payer system when one of my family members is hospitalized. So what are the rules and laws regarding that? What is our collective decision on that when we decide to live together as a nation? And so that's the left lower quadrant. So all this stuff comes up in the treatment room. And I love what I do. So if we summarize, the left-hand side of the quadrants are the subjective experience that we all know about, and it's what good poetry and good literature and music is about. It's why we seek the spiritual in our lives. The right-hand side of the quadrants are what's our objective experience. How many of you in here have a blue shirt on? How many of you here have proteins, certain proteins in your urine? So most experts agree an integral approach is best. I like this definition. Integral means, among other things, that the entire scope of treatment of any given individual occurs in a very large context. So it literally embraces and looks at life, your specific life conditions, your relationship with others, your constitutional type, your level of cultural development. Do you see yourself in the context of the whole world, or are you identified with your clan or tribe? You know, in the South, we kind of stick together, you know. We don't really spread out to other parts of the world. So there's a very specific thing that's called Southern cultural conditioning, you know. It ultimately considers the patient's degree of integrity. Integrity is defined as a narrow gap between the highest that's been revealed to us and how we're actually living. So if I say I want to do an anti-inflammatory diet and I make that commitment and I declare to my family that I'm going to do that and I can't follow through with it, that's a lack of integrity on my part. And we're all divided. I'm a big coffee drinker, and it's revealed to me that that's not a good thing for me to do. I'm having some issues with it, and so I've got to cut that out. So I can relate to that issue. And it's, I think, the paramount thing when we're seeing a practitioner, that we simply can't remain victims of our circumstance. So integral medicine asks a lot of the patient. It asks the patients to take responsibility for the choices that they're making. And that's hard for us to do because we live in a culture of endless choice. And of course, integral medicine considers the symptoms. So let's talk about acupuncture, because I found it a medicine so beautifully suited in the practice of integral medicine. Acupuncture, simply put, is the insertion of solid, very thin needles into strategic points on the body to ensure the smooth flow of qi. The model for pain in Chinese medicine is that pain is the blockage of qi. It's the stagnation of qi in the body, somewhere in the body, either in an organ or in a meridian. And so we place needles in the body, and we'll talk about why the needle is so perfectly suited to its function. It actually moves electrons through the saltwater medium of the body. We'll take a look at that in a minute. But there's also another aspect to acupuncture. This is sort of a right upper quadrant explanation of what acupuncture is and what happens to endorphins when you place an acupuncture needle in the body. endorphins typically go up and other neurotransmitters are regulated. But also what happens in the treatment room itself. So it very much considers your subjective experience. Most patients describe it as relaxing and they actually look forward to their visits. Let's talk a little bit about some of the terminology just because it sounds so foreign to us, but it's actually beautiful and poetic. Let's talk about qi and then yin and yang, the organs and meridians. Qi is present in all life, and this is sort of the cursive. Do I have a pointer on my clicker? Okay. Let's see. Oops, sorry. Well, in any case, down at the bottom of this slide, you'll see there's some grain in a pot. This is the grain in the pot. This is the rice pot. This is the rice pot lid that when we add energy or heat to the pot, the lid begins to move. And out of the rice pot comes the steam. At the top of the slide. So qi points to the fact that we are energetic beings, but we are in a material form. So I love it. It sort of correlates with Einstein's brilliant discovery that E equals mc squared. Energy equals matter multiplied by a coefficient. We can look at levels of qi. Contrast the 18-year-old teenager that's broken a limb, that's hollering in the ER and raising a stink and requiring a lot of attention. Compare that to that frail 85-year-old grandmother who's curled up in the stretcher in the hall of the ER not making a peep. They're both hurting. They both require attention. One has so much qi it's coming out in a great force, and the other's withdrawn and curled up in a ball. One is a very young presentation of pain, hollering and screaming and kicking and demanding attention, and another is a very yin presentation, curled up in a ball, being very quiet, probably cold, needs a blanket. So yang and yin are complementary terms. We can't experience what it's like to be in hot water unless we've ever been in cold water. So they're relative terms. They also transform one into the other. So just as night transforms into day, that's a metaphor for, we can look to yin transforming into yang and see that the two correlate. So for example, when it's dark outside is really when we should be sleeping. So I work with a lot of night workers, ER nurses and physicians and other night workers. And there's a very specific thing that we do to reset the yin-yang clock, so to speak. We're meant to be awake, engaged, alert, and interested during the day. That's the yang time of day, and sleeping and restored and restful at night. So here's a list of yang things, and here's a list of yin things. The archetype for the yin thing is the nursing mother. The nursing mother holds the baby close to her chest. There's milk being transferred from the breast to the baby. There's the female tenderness, quiet touch. The archetype for yang activities is the male plowing the fields. The yang surface of the body, which is the back, is to the sun. He's digging and sweating in the sun, and he's actually doing a lot of hard work. So that's some differences between yang and yin. So in Chinese medicine, I'm always asking, is this a yin phenomenon or a yang phenomenon? And we'll talk about how that applies to IC in just a second. The organs are all related to each other. You can see that the yang organs are mostly hollow organs, and their paired yin organs are mostly solid. So bladder goes with kidney, small intestine with heart, and so forth. There's also an interesting relationship between the bladder and the small intestine, and so some patients do in fact do very well with an anti-inflammatory diet or a gluten-free diet because there's a relationship between heat or inflammation in the small intestine and interstitial cystitis pain, bladder pain. This heat gets transferred through paired organs to the bladder. So often we'll spend quite a bit of energy healing the gut in a patient with IC or pelvic pain, and this can make a big difference. in the quality of their life. So the needle actually acts like a little micro battery, and this is a right upper quadrant explanation in our AQUAL theory, but it's a beautiful explanation because we're actually doing something with the needle. We're moving stuck energy, if you will, from one place in the body to the other. Whenever you place a needle in the skin, it's warmer, of course, on the inside of the body than it is on the outside of the body. And whenever there's a temperature differential across a metal, there's a small but measurable electrical potential. So this is potentiated through two things with the needle. One is a bimetallic configuration. Most acupuncture needles are comprised of metal at the shaft, and then there's a coiled metal that's often a second metal that cools that part of the needle and potentiates this temperature gradient, which then potentiates the electrical gradient activity of the needle. So we're actually directing electrons through the body. Now there's a big overlap between the autoimmune diseases, the immune system, and interstitial cystitis. And so if I place the needle very superficially in something called a tendinomuscular meridian, I'm affecting that. So if I have a patient that's presenting with IBS, fibromyalgia, lupus, as well as IC, I might needle her very superficially. There's a very specific treatment that is well suited for this. If we're working on, I have patients who say, no, doc, it's just the bladder, it's just the bladder, everything else in my life is fine. And sometimes that's the case. They don't struggle with depression. They're happy to be here. They take a very wide view on their symptoms and aren't victimized by having to stop and go to the bathroom every 10 or 15 minutes. I might needle this patient very deeply on the principal meridian because this energy goes directly to the organs. There's been a lot of nice studies that show that there's a connection between these peripheral channels or meridians and the underlying organs. These are some of the points we use, but don't be surprised if your acupuncturist only puts needles from the elbow down and the knee down. These are the big energy moving points of the body, and I rarely use needles even on the lower abdomen. I'm almost always using needles in the hands and feet. Occasionally I'll use these back points. They do happen to all be along the bladder meridian. That's what BL stands for here on the sides. Now, I don't actually practice something called traditional Chinese medicine, but it's a useful way to talk about how IC is seen from the TCM point of view. TCM is comprised of acupuncture and related techniques such as cupping. We also use herbs in our clinic. And I can make Chinese medicine pretty simple for you. If something's cool, you warm it up. If something's too hot, you cool it down. If something's too yin-y, too much yin is there, you add a little yang. So if there's too much rice in the pot and it's not cooking enough, you're going to add a little heat to it. That's a little yang, and vice versa. If something's deficient, and a lot of my patients are deficient, they're so exhausted by their pain, they get winded walking up a flight of steps, we're going to try to add more energy to that patient. We may use an herb called mugwort or Artemisia vulgaris in a technique called moxibustion. Or if they're excess, they're restless, they're talking quickly, they're uncrossing and crossing their legs, they have palpitations. This is a condition of excess. We might disperse some of those excess. We might use some points that disperse the excess. So from a Chinese medicine perspective, acupuncture is actually seen as a condition of dampness. So the principle would be to then dry the dampness. It's also often seen as a condition of heat, although not all patients have heat. Not all patients complain of burning urination. Some actually have a cold urination, a sensation of cold. But typically, heat is a very common presentation. And then excess. Pain is almost always an excess condition. And of course, the associated symptoms in the IC patient is often urinary urgency and urinary frequency. Interstitial cystitis is seen as an internal phenomenon, although I was interested when I looked at it was the last IC update, I think I got it a couple of months ago, there was a little pie graph in there on what do you think triggered your IC? Do y'all remember that? I think it was about 20% of patients said recurrent urinary tract infections were a trigger for them. That was an interesting pie graph. I refer you to it. it's interesting because in the treatment room, sometimes I do ask the patients, well, what do you think's going on? The patients know their bodies, and they know very well what's going on inside of their bodies. And we simply can't talk about Chinese medicine and integral medicine without considering psycho-emotional, dietary, and even spiritual factors. We don't want to foster the notion that if you're spiritually fit, you'll never get sick. Because it's just not true. Some of my New Age colleagues tend to promote this idea. But the truth is, the material body can get sick. We're divided. And some of the greatest spiritual teachers have developed cancer. So I'm not saying that at all, but it is something that we're bringing up in the treatment room to the extent the patient's comfortable with it, because it's an aspect of our humanity. Now, the literature review is scarce. We're not going to find a lot of studies in peer-reviewed literature. We're certainly not going to find a lot of studies in the Western medical literature. But there's been a few that demonstrate that this thing called Electro Acupuncture is very useful for intractable interstitial cystitis. So there's a couple different ways to do that. There's certain types of electrical acupuncture that disperse excess, and there's certain types of electrical acupuncture that strengthen or tonify deficiency. So anyone who's practicing electro acupuncture on a regular basis will know and be able to speak to this. There have been several studies published in the Chinese literature looking at bladder pain that have demonstrated a positive result with acupuncture. And there's currently more than one NIH study underway to evaluate the efficacy of acupuncture in IC patients. And here's some useful websites if you want to look into that. But I was very interested that the NIH takes an interest in establishing the efficacy of different complementary and alternative treatments. And a big area of study is, in fact, acupuncture. So they're looking at acupuncture for hundreds of conditions, including those I've listed here: migraines, insomnia, hypertension, breech presentation, irritable bowel syndrome, and 100 others. So we'll know more as time goes on. But what I find useful is my own direct clinical experience. Let me just give you some statistics on IC. So out of the 100% of patients that I see that have IC and related pelvic floor dysfunction, pelvic pain, 5% or so are going to have miracle cures. You'll read about these people on our website. They'll have 2 or 3 visits and their symptoms are completely resolved. We've all had that. I don't know if it's a miracle or if it's a fluke, but I think most practitioners in medicine have had patients that have done supremely well with a particular therapy, and I've learned to not take credit for that, because then I'd have to blame myself for the 20 or 25% that don't respond at all to acupuncture. So about 20 or 25% of patients with pelvic floor issues, interstitial cystitis, and bladder pain won't respond to what I do in the clinic. Some of them keep coming back to see me because even though that doesn't make their bladder pain worse, it helps with their hypertension and their insomnia and their anxiety. But I found this, that certain patients just are not responsive to it. And most people are somewhere in the middle. In our clinic, we do individualized treatment. We don't copy studies. The problem with doing randomized, placebo-controlled trials is some NIH practitioner will tell me do once-a-week treatment on these 100 interstitial cystitis patients and use these points. Well, this takes away my ability to see that the patients aren't the same from week to week. So if you're in a flare that came about because you had wine one night and then coffee the next morning to help you with the hangover, and you're in a flare, you might have a condition of heat. And so I need to change the points that I prescribe that week when you're in my clinic to clear this heat. And if you're in a study and it's telling me I have to do these 8 points and I can see that some of those points are actually going to make the heat worse, I don't like that. So we actually need to have some useful conversation, maybe even some roundtable conversation on what does constitute efficacy studies in these fields of alternative and complementary medicine, but particularly acupuncture. Because these treatments don't fit the randomized controlled trial, the best we can do are case series, and we can look at 100 IC patients that I've treated and say, how'd they do compared to a practitioner that's doing some other form of therapy. But this is inadequate and leads to a lot of erroneous conclusions, and there's more work to be done in this area. And in fact, I'd like to talk with some of the MAP people. I think this would be an interesting conversation to have. So as far as herbs go, contamination is a big problem. One study showed that a third of the Chinese herbs being imported from all over the world were contaminated, either by heavy metal contaminants, other herbs, and some by Western pharmaceuticals. So we ask that you get your herbs from a reputable source, and that's probably going to come through a practitioner or through a company like we saw today, where there's quality assurance measures in place and where we can ask questions. So a patient called me and said, this bottle of herbs are darker than the last bottle of herbs I got. It happened to be from an herb company called Golden Flower. I called the company. I said, this patient's comparing the color of his herbs. He's concerned because one's darker than the other. Please help me. And I did get a phone call back from the owner of that company, and he said there was a batch of herbs that came in that had a lower concentration of active ingredient because there was less rainfall that year. So we had to add more bulk herb of this particular herb, and it's darker because of that. So there was an explanation that made me feel better about prescribing his product. So quality assurance is very important. And I think that's the same with like the omega-3s. That's a big, in probiotics, for example, we need standards. The herbs are customized for each patient, so I can't give you a list of herbs that help for IC. I just can't. The list would be too long to read, and it would be confusing. But one particular herb we do use, I just bring this up as an example, is an herb called Gentiana Drain Fire. It's comprised of 12 separate herbs in what we call a patent, so it's in a pill form. It drains fire or heat from the liver and gallbladder and drains damp heat from the lower burner, which is where the bladder resides. So this would be for a patient that has heat symptoms, red face, burning eyes, irritability. They may raise their voice and shout a lot. They may appear red in the face. They're uncrossing and crossing their legs. They may present with restless legs. So this would be a good herb for that patient. And I do like golden flower for this particular patent herb. Of course, it makes sense that the newer a problem is, the quicker it's going to resolve. So if there's an acute onset, and by that we typically mean the symptoms have been present for less than 3 or 6 months, depending on who you read. Of course, these patients are going to need fewer treatments, and the treatments may be grouped close together, sometimes as often as twice a week. If it's a chronic condition, so we go to the other end of the spectrum and we're treating the patient that has IC symptoms, pelvic pain symptoms for 20 years, I'm really not looking for them to get better today. I mean, I would like that if that happened, but I'm really looking for them to, in a year, say, this is what acupuncture did for my chronic pelvic pain and IC symptoms. So we'll see those patients maybe once a week at first, but we'll fairly quickly space them out to maintenance somewhere on the order of once or twice a season. All of y'all know that having a chronic medical condition, especially something as complex as chronic pain, can put us at risk for inviting these unproven or what we call unconventional therapies into our lives. And so I hope I've given you at least some words to ask your healthcare practitioner. Now, a lot of Western physicians, a lot of my colleagues in Western medicine are very disappointed that I'm a defector. They say, I can't believe you. You were a well-respected anesthesiologist, and we love sending you our pain management patients to do the blocks, and now we don't have anyone like you to send them to. And plus you're doing something that's woo-woo-y and unproven. They don't like it. It's interesting, though, because over the 15 years that I've been doing it, a lot of them I've seen in my clinic. I've seen their wives, their children, their parents. So the definition I like of humility is being interested in what we don't know. So please invite physicians into your life that are interested in what they don't know, and we'll look into these complementary and alternative therapies. Physicians who have studied either integrative or integral medicine can be helpful resources. So, for example, Andrew Weil has an integrative medicine program. Tufts University, Duke University, Stanford, they all have multidisciplinary integrative programs. And so these can be useful resources. But the truth is, most of us are getting care in private clinics, aren't we? But you can use these places as resources. One way to find a medical acupuncturist is to go to the website medicalacupuncture.org. And one way to find a licensed acupuncturist is to go to nccaom.org. So if you're interested, we can talk about what those two different practitioners are. But I think what I'm going to do is end here and take some audience questions. These are some other integrative therapies that I interface with and that I can speak a little bit about if you're interested, but I think that's going to be our next talk, so I don't want to overlap too much with that. I'm particularly interested in the breath work that comes up. A lot of chi, if you will, gets stuck in the diaphragm, and patients will present with reflux and burping and feeling full after they eat. And something as simple as breath work, and I noticed there's an article in our IC update this month on how to breathe. So I'm particularly interested in that as it comes about with therapies such as yoga, the deep diaphragmatic breaths that we do with yoga. So let's take some audience questions. Anita?
Thank you, Dr. Kelly. We have one question from the audience. Many IC patients are on SSI, not able to work, or they may not have medical insurance, which recognizes or covers alternative medicine. How can I find an affordable, integrative, and integral treatment for IC?
That's a great question. And for example, Medicare never covers acupuncture for any reason. Even if your physician writes a letter and says it's the only thing that works for her, there are patients where acupuncture or herbs are the only things that they found that work. So they're never going to cover it. So in my clinic, because I'm not affiliated with a university, I can sort of do what I want. So it's in the spirit of generosity. I offer acupuncture on a sliding scale, for example. I'm very creative with bartering. I've bartered quite a few things for acupuncture. There's a thing called community acupuncture whereby, and I love this, it's whereby, and it's available in many major cities, but you can go in and with a group of anywhere from 5 to 30 patients with perhaps even your condition, chronic pain, get acupuncture in a group. It's almost always ear acupuncture. There's some very nice points on the ear for pain management. And this is low cost on the order of ranging from just a few dollars, $5 or $10, up to about $30 or $35. There's a wide range in what you'll pay for acupuncture. In major cities, you'll pay as much as $150 for a treatment until the competitive market drives the price down. And then in rural settings, you might find someone to treat you for as low as $50 or $75. So there is a wide range. About 20% of your insurance companies are covering acupuncture. With the Affordable Care Act, I have a feeling they're going to go along more with the Medicare guidelines and not reimburse for acupuncture right now.
So how would a patient find a healthcare provider that will be open to integrating some of these therapies into their treatment for IC?
So how would an IC patient, okay, so how would they find someone who has a generous spirit and is willing to barter or do it for free? That's the first question. I pick up the telephone and call. I have a rule of thumb in my life and in my family now that if I call a practitioner, or for that matter, any professional, and they don't call me back, I don't use that practitioner. I've had to fire a lot of physicians in my life because it is really increasingly hard to get a phone call back. So I try to make myself available. In fact, we have a policy in our office that we return all phone calls within a 24-hour period, and most are within an hour or two. So you're just going to have to get on the horn, talk with in your support groups. There is something called Chronic Pain Anonymous. This is a chronic pain support group that there's over 100 in the United States. There's a couple per state. I imagine they're in major cities. But you'll find resources there. Those are comprised of various patients that have all sorts of pain problems, but it's one patient talking to another, which is why organizations such as ICA are so important, because you can ask, does anybody have experience finding a practitioner that is willing to barter or do a fee-for-service fee schedule? So I don't have an easy answer for that. You're going to have to be your own advocate, and I hope you have people in your life that can help you advocate when for some reason you can't find your voice. I, for one, can be easily intimidated by a loud voice on the other end of the phone, and so sometimes my husband will say, "Let me take the phone," So I hope you all have that in your life.
Great response, Dr. Kelly. We have another question from the audience. Is it necessary for an acupuncturist to know about IC in order to treat it?
I love that question. I saw that question came in over the email, and well, the simple answer is yes, of course, and that's why I love having one foot in the Western world, and I maintain my board certifications and certificates and licensing in the Western world, but I also have a foot in the Eastern world. Of course it's necessary to understand the medications a patient's on, for example, the pathophysiology of interstitial cystitis. And yet there are some excellent practitioners of Chinese medicine that don't. So, how educatable are those practitioners? How interested are they in what they don't know? So I'm sure y'all have had this experience where you've educated the physician or practitioner. You've told them about what IC is. I imagine almost every one of you has had that experience. So I would say, yes, it is important for them to know, and they can be taught.
So it shows that it's important to be empowered with knowledge so you can talk to your healthcare providers about IC.
Absolutely.
We have one more question from the audience. What are your thoughts on using Ayurvedic medicine for IC?
I don't know about that. I just don't know anything about Ayurvedic medicine. I do know that it's an energetic medicine, much like acupuncture, and I do know that there's a lot of overlap. So I would say if I had my choice of going to an Ayurvedic practitioner who practiced integral medicine within a developmental context and was going to hold me to a higher standard when I fell short on some goal that I had set for myself, and help me through that difficulty and help me properly exert my will, I would choose that over acupuncture any day. That being said, I don't know that much about that medicine other than what I've said.
It sounds like it's very individualized and you just have to see what kind of works for you.
Yes, and I like the metaphor or the image of the mobile that Dr. Carr put up earlier. How open is your coordinating physician? We spoke a little bit about this morning. Most of us don't have a coordinating physician. We almost have to be that for ourselves. But how open are they to every single aspect of that mobile being balanced? Because you as patients have discovered that it takes a little bit of this and a little bit of that to get better. And how open is your physician to exploring that with you? So I love to be interfacing with that type of medicine where I'm considering that. I had someone recently told me that not Reiki, but Rolfing was a therapy that they had received great benefit from. I don't know anything about it, but I registered that.
Okay, we do have time for one more. Are there any natural alternatives to Elmeron which attempts to repair the bladder wall?
Yes, there are. There are, in fact. But I can't give you the list, and I know that might seem like a cop-out, but it depends on what your presenting symptoms are. It depends on what your constitutional type is. It depends on what your diet is like. So yes, there are herbs that clear heat, that clear inflammation from the bladder. We don't ever look at the bladder wall before and after like they might in Western medicine, but yes, there are herbs that do that. A trained herbologist, one of the pitfalls of going to a physician acupuncturist is they're probably not going to know that much about herbs, whereas a traditional Chinese medicine trained acupuncturist is going to have a couple of thousand hours in Chinese herbology. So there are pros and cons to seeking out a physician acupuncturist versus a licensed acupuncturist. And if you're particularly interested in herbs, you would want to see most likely a licensed acupuncturist or someone that's both a physician acupuncturist and an LAC.
Great. Thank you so much for your questions, and thank you, Dr. Kelly, for your responses.
Thank you.